Hello, my name is Vicki. I'm going to be your nurse for the day.
Okay.
Could you state your name and your date of birth for me?
Marissa Gidry, 2696.
Okay, so what we're going to do is assess your respiratory and your cardiac systems. So we're going to start with your respiratory. I'm going to need you to face that wall. And first we're going to do your posterior chest. I'm just going to look at it, make sure it's symmetrical. And it is. Now I'm going to palpate and you just let me know if you have any tenderness or pain.
No, ma'am.
Alright. Next thing I'm going to do is I'm going to check your tactile framatus. And I'm going to run my hand across your back and you just repeat the word 99.
99. 99. 99. 99. 99. 99.
Okay, good. And next thing we're going to do is check your symmetrical expansion. So I'm going to place my thumbs right here and you just give me a big deep breath. Alright, good deal. And now I'm going to percuss across your back. We're just checking to make sure there's no dullness or hyperresonance. Alright, looks good. And now we're going to listen to your lungs and just take a couple of deep breaths for me here and then, and let me know if you get dizzy or lightheaded.
Okay.
Alright, good deal. And now we're going to move on to your anterior chest. So just turn to the front for me. And same as the back, I'm just going to look and make sure it's symmetrical. And it is. Now I'm going to palpate. Do you feel any pain?
No, ma'am.
Alright. Next thing I'm going to do is check your tactile framatus again. So just repeat 99.
99. 99. 99. 99. 99. 99.
Okay, good. And next thing we're going to do is check your symmetrical expansion again. So I'm going to place my thumbs right here and give me a big deep breath. Alright, great. Now I'm going to percuss across the front. And again, checking for dullness or hyperresonance. Alright, good deal. And now we're going to move on to your cardiac system. So we're going to start with your carotid artery. We're going to palpate it. And now we're going to listen. Okay, everything sounds good. And now we're going to listen to your aortic area, your pulmonic, your tricuspid, and mitral valves. Alright, and now we're going to do the same thing, but I just need you to lay down for me with your head on that side. Okay, so first thing we're going to do is just look at your jugular veins and make sure they're not distended. Okay, great. And now I'm going to feel your aortic area, and you tell me if you feel any tenderness.
No.
Pulmonic. Your tricuspid valve.
No.
And your mitral valve.
No.
Alright, and now I'm going to also listen while you're laying down. Alrighty. Okay, now that completes our physical assessment for the day. Thank you very much.
Thank you.
Oh, sorry. Alright, so for this patient, I would note that her posterior chest, it was symmetrical, and also her anterior chest was symmetrical. There was no tenderness noted on palpation. There was no abnormalities noted on auscultation for either chest walls. Her symmetrical expansion was intact, and her tactile phrematus was also intact with no abnormalities. All her lung lobes were clear. Her breath sounds were normal. And then onto her cardiac system, S1 and S2 were heard, and the vessels of the heart were all palpable and auscultated with no abnormalities noted while sitting and lying down. Thank you.